Dr. Olson now explains the timing of strangulation before giving her final opinion on Cora's cause of death.
Vessels in the face and brain, such as capillaries or venules, they are subject to rupture.
And as that pressure is building in those veins and are rupturing, is that painful?
Just like our blood vessels run throughout all of our body, there are nerves throughout all of our body as well. And so there is a component of pain present until loss of consciousness occurs.
And how long can it take, or does it take, for loss of consciousness to happen?
I cannot put a specific time on it for the interval. There's multiple variables to consider in a case-by-case basis. The type of ligature used, the force of the ligature used against the neck, as well as the intensity and duration of the altercation. However, in situations where there's complete oxygen deprivation, loss of consciousness can occur as early as 10 to 30 seconds, with brain damage beginning at the 1 minute mark and irreversible brain damage and subsequent death occurring around as early as 5 minutes, again with the caveat that there are variables that might accelerate or decelerate that time frame.
Is there a type of constant pressure that's required to cause that loss of consciousness?
Ultimately, once the brain has a critically low level of oxygen, a loss of consciousness will occur. It takes an average of 4 pounds to compress the veins of the neck and an average of around 10 pounds to compress the arteries of the neck.
And so if someone's squeezing something or pulling something around the neck at that 4 pounds or 10 pounds of pressure in a consistent basis without any resistance, does unconsciousness happen faster?
It could occur faster, yes.
What if someone's resisting or struggling or pulling away? Could that take longer?
When the body is in a state of stress, you have a stress response that demands an actual increase in oxygen utilization by our body. So in the presence of an increased demand with a decreased amount being delivered to the brain, it can accelerate the timeline to loss of consciousness.
What do you mean by accelerate the time to loss of consciousness?
It's obvious what she means. No, overall, you can ask.
It would just make it occur faster.
And so if that pressure isn't constant, say someone struggles and is able to get free a little bit, and then you have to tighten it again, does that make it take longer?
Sustained.
You said anywhere from 5 to 30 seconds. What are the factors? I'm sorry, you said 10 to 30 seconds. Is that correct?
Yes, for loss of consciousness.
What are the factors that are at play for whether it's 10 seconds or 30 seconds?
Again, there's multiple variables. So the force of the ligature against the neck, the actual ligature itself, and the intensity and duration of the altercation.
And once someone loses consciousness, do they immediately die?
No. So if there's no intervention, the brain continues to have a lack of oxygen. And so until the brain cells start to die, it's irreversible injury to the brain. The person is alive until the body can no longer sustain the lack of oxygen.
If someone is strangled to the point of unconsciousness and the strangulation stops, can they wake up?
Without intervention is very unlikely.
So do you recall testifying previously that when asked if a person were to use a ligature around someone's neck to the point where they pass out?
But, counsel, we had that answer, right?
It's an inconsistent statement.
This is your witness.
I know, and I can impeach with an inconsistent statement.
I see it sidebar.
Plot to strangle someone past the 30 seconds to cause death?
No. Once the brain is subject to oxygen deprivation and brain cells start to die, it's irreversible, and so it will continue to progress towards death if there's no intervention.
What do you mean by intervention?
Resuscitative efforts, if somebody tried to give CPR.
It would be your opinion that pressure would need to be continually applied even after losing consciousness to cause death?
Sustained.
Hold
on. Sustained. Next question.
So your testimony is that you can strangle someone for 30 seconds, let go, and then they die?
I said that in this presence of complete oxygen deprivation, there is a general time frame, and so 30 seconds, I cannot give a specific number to that. Once strangulation occurs, again, the brain starts to be subjected to a lack of oxygen. So whether the ligature is present or whether the ligature is not present, the oxygen deprivation and irreversible brain damage is already occurring.
And there's no coming back from that.
Not without intervention. It's very unlikely. Again, the brain cannot heal those cells.
Did you form an opinion to a reasonable degree of professional certainty, to medical certainty, as the cause of death of Cora?
Yes.
And what was that?
Asphyxia.
That is Dr. Olson's ultimate medical opinion. Cora's cause of death was asphyxia by strangulation.
And was that by manual strangulation?
By strangulation.
Mechanical strangulation, I mean. Yes. Did you also examine or do an autopsy on Dawson Clancy?
Yes.
And when was that?
January 25th.
And did you observe injuries on Dawson Clancy when you did the external examination?
I did observe injuries to Dawson. He had trauma to his neck with associated injuries of the head, as well as minor injuries to his left arm and his legs.
And if we could pull up photo 2166. What are we seeing in this photo?
This photo is a picture of the lower lip of Dawson being pulled down, and we can see, again, similar to Cora, these petechial hemorrhages on the inside of the mouth.
And can you also see them on the eyes in this photo?
You can see periorbital petechial hemorrhages, so the skin around the eye.
And were there also those same type of hemorrhages when you lifted the eyelid?
Yes.
And if we could have photo 2149. What are we seeing here?
Dawson on his neck, similar to Cora, had a linear horizontally oriented ligature furrow consisting of an area of pallor around the neck. He had distinct superior and inferior edges to his furrow as well. This is on the back side of the neck, where we can also appreciate abrasions that are in line or parallel with the inferior and superior edges of the furrow.
And if we could have photo 2147, please. What are we seeing in this photograph?
In this photograph, we can appreciate the distinct area of pallor here on the neck, again representing the ligature furrow with diffuse petechial hemorrhages of the skin of the face.
And what are we seeing there on his shoulder?
This is just some dried body fluid.
And if we could see photo 2151, please. What is depicted in this photograph?
This is a similar photograph to the one just shown here, where you can see the distinct area of pallor representing the ligature furrow with superior and inferior edges, and again, the diffuse petechial hemorrhages of the face.
And these photos of Dawson's face, the petechial hemorrhaging on the face, appear to be darker than those and more expansive than those on Cora's face, correct?
They appear more prominent in Dawson than in Cora, yes.
Dr. Olson is now identifying similar findings in Dawson, but says the hemorrhaging was more prominent than what she observed in Cora.
And what can cause the damage being more prominent and more dispersed over the face?
Again, petechial hemorrhages occur as a result of rupturing of small vessels in the skin. And so the fact that there are more present in Dawson is indicative that there were moments where some blood did reach or push through the furrow or the ligature in little spikes or peaks, which would just result in momentary increases in blood pressure that would result in more petechial hemorrhages.
And what would cause that blood being able to flow?
Any movement against the carotid arteries. The carotid arteries are thicker and more muscular than the veins, so they're more likely to push through with the blood. So that could be movement of the ligature or movement of the person handling the ligature or movement of Dawson himself.
So it could be from Dawson struggling, or it could be from more pressure or force of the ligature?
Yes, changes in the pressure of the ligature.
And if I could see photo 2143, please. What are we seeing in this photo?
This is the back of his left forearm. It is a little pale with the light, but there were 3 small bruises on the back of his left forearm.
And going to photo 2155. What are we seeing in this photo?
This is a picture of us. So at this point position, Dawson is face down, so we're looking at the side of his right leg, and we can see a small faint bruise here.
And then going to photo 2144. What are we seeing in this photograph?
This is an up-close photograph, but I can appreciate that there are small bruises in the center of the image.
And photograph 2156. What are we seeing in this photograph?
In this photograph, we're looking at the back of the legs. The one closest to us is the left leg. The one farthest from us is the right. You can see bruises here, here, and here, as well as the inside of the right knee.
And so when you said here, here, and here, that was the outer portion of the
left upper leg.
Thank you. We could have photo 2119, please. What is depicted in this photograph?
This is an up-close photo of his hands.
And is there any significance to the blueness of the fingernails?
I would not have called these necessarily blue or cyanotic. That would be more of the discoloration of his face. There is some subtle blueness to the nail beds, which is again a sign of cyanosis, which is just reflective of a decrease in oxygen in the body.
And last photo is the PDF, please. What are we seeing here?
This image, Dawson is face up, and we can see his right and left legs. Here on his right lower leg, we see small bruises.
Dr. Olson's examination of Dawson continues from here, including the remaining injuries and her ultimate medical findings.